Today, we are diving into one of the biggest, most complex challenges in all of medicine, Parkinson's disease. We're going to go from the personal stories of millions of people all the way to the most advanced labs on the planet. This is the story of the relentless global hunt for a cure. Just imagine that feeling for a second. An act as simple as walking, completely transformed. You know, these words from a patient, they really capture the incredible hope that's at the heart of this entire story. This isn't just about managing a disease, it's about getting your life back. So, to really get what this hunt for a cure is all about, we have to start by understanding the disease itself. See, Parkinson's is often just boiled down to a tremor, but for millions of people, its impact goes so much deeper. And we're not talking about some rare condition here. Over 5 million people around the world are living with Parkinson's right now. It's a number that really puts a fine point on the urgency and the massive scale of this fight. So, what's actually happening inside the brain? Well, Parkinson's is a degenerative disease. Basically, the brain cells that make a really important chemical called dopamine, they start to die off. And it's that loss of dopamine that causes those classic motor symptoms you've probably heard about. The tremor, the stiffness, the slow movement. But the disease doesn't stop there. It can also mess with your thinking, your mood. It's a complex, whole-body condition. Okay, so while the ultimate goal is, of course, a cure, a huge part of this fight is about helping people live better today. So let's look at the gold standard treatments that are already making a massive difference right now by managing the symptoms of the disease. For decades, the main weapon in the arsenal has been a drug called levodopa. And it's a really brilliant piece of chemistry. It's basically a precursor that gets into your brain, and then your brain converts it into the exact dopamine that's missing. It's like refilling a tank that's running low. But here's the catch. When you take it as a pill, levodopa levels can spike and then crash. It creates this roller coaster effect. Patients have these on times where they feel pretty good, but then these awful off times when the medicine just wears off. The solution? A totally new approach using subcutaneous pumps. Kind of like an insulin pump. They deliver a slow, continuous flow of the drug, which smooths out those peaks and valleys for a much more stable, predictable day. But for some patients, medication just isn't enough. And that's where something called deep brain stimulation, or DBS, comes in. The easiest way to think about it is like a pacemaker, but for your brain. Tiny little electrodes are put into very specific parts of the brain, and they send out electrical impulses that kind of override the faulty signals, causing all those motor symptoms. And get this, the technology is moving so incredibly fast. The latest DBS devices aren't just sending out a constant signal anymore. They're adaptive. They can actually listen to the brain's signals and then adjust the stimulation in real time. This means the therapy is totally personalized, minute by minute, to what a patient's brain actually needs. It's a massive leap forward. Okay, managing symptoms is absolutely crucial, but it's not a cure. To really stop this disease for good, you have to go deeper, to the root cause. And this has sent researchers on a hunt for the real culprit, the thing that's actually responsible for killing those brain cells in the first place.
I mean, this is the central mystery, isn't it? The question scientists have been trying to crack for decades. Because if we can figure out what kicks off this whole chain reaction, well, then we can find a way to get in there and stop the disease in its tracks.
So meet the prime suspect, a protein called alpha-synuclein. Now, in a healthy brain, it's just doing its job. But in Parkinson's, it starts to misbehave. It misfolds, it gets all sticky, and it clumps together into these toxic little balls called Lewy bodies. And these clumps are what scientists believe sneak in and ultimately kill those precious dopamine neurons. All right, so if alpha-synuclein is the enemy, how do we fight it? Well, the modern research world isn't looking for a single magic bullet anymore. Instead, it's become this coordinated, multi-front attack on the disease, and the progress is just incredibly exciting. One of the most promising ideas is immunization, and there are two main ways they're trying it. Active immunization is basically a vaccine for Parkinson's. It teaches your own immune system to recognize and attack that toxic alpha-synuclein. Then there's passive immunization, which is more direct. You just inject ready-made antibodies that can get to work right away, grabbing and clearing that bad protein from the brain. And listen, this isn't just a theory. A specific antibody drug called prasinezumab has shown some really encouraging results. In one analysis that went on for 4 years, it actually seemed to slow down how fast the motor symptoms got worse. This is a huge deal. It's one of the very first therapies that has shown it might be able to actually change the course of the disease. But the cool thing is, the attack doesn't just stop with alpha-synuclein. researchers are exploring a whole range of different targets. They're creating drugs to shut down overactive genes, like one called LRRK2. They're going after brain inflammation. They're even testing drugs that might stop multiple toxic proteins from clumping together, not just in Parkinson's, but maybe in Alzheimer's too. Let's just focus on those genetics for a second. We used to think genes were only a tiny part of the story, but now we know an enzyme called LRRK2 is hyperactive in about a third of all people with Parkinson's. That is a total game changer. It makes this one enzyme a massive target for new drugs that could help a huge chunk of the patient community, not just people with some rare genetic thing. And then there's maybe the most ambitious idea of all, cell replacement therapy. The idea itself is breathtakingly simple, even if doing it is incredibly complex. Scientists take a patient's own skin or blood cells, reprogram them in a lab so they become brand new dopamine neurons, and then they surgically implant them back into the brain to replace what was lost. And human trials for this? They're already happening. All of this research, targeting proteins, genes, inflammation, even trying to repair the brain itself, it all signals that we're in a completely new era. We've moved way beyond looking for one single solution. Now we're building a whole toolkit to fight this disease. And if you want a sense of just how much momentum is behind this, just look at this number. In one recent year, almost 14,000 scientific papers on Parkinson's were published. This isn't some small group of scientists in one lab. This is a massive, dedicated global army working around the clock to find answers. This quote from Parkinson's UK just hits the nail on the head. It perfectly captures the modern way of thinking about a cure. Because Parkinson's is different for everyone, the solution probably won't be a one-size-fits-all pill. Instead, it's going to be a personalized combo of therapies, drugs, maybe cell replacements, lifestyle changes, all tailored to that one person's specific version of the condition. So in the end, the question really isn't if we'll find ways to slow or stop Parkinson's anymore, it's when and it's how. With science attacking this disease from every possible angle, from vaccines to gene therapy to stem cells, the future is brighter and more hopeful than it has ever been. So which one of these incredible fronts will be the one to bring that first massive breakthrough? Well, only time will tell.